How can that be treated? Well, I would emphasize to you, and this is what's, I would try and emphasize to you about coming to Benenden, is early diagnosis. It's really important to get diagnosed early with these situations, because if you don't, then it's likely to get worse, all right? And it sounds obvious, but it is. And the earlier you get diagnosed, the less likely you are to need surgery. Because most cases of rhinosinusitis, once they're diagnosed, are treatable medically without the need for surgery, with advice, various nasal drops or sprays, targeted antibiotics, and treatment for your allergy if necessary. If, however, it's left untreated, you may get more inflammation inside your nose and eventually nasal polyps, which are a sign of long-standing inflammation which has been not adequately treated in your nose. And also, actually, there's good evidence that having problems in your nose makes your other asthma and chest symptoms worse. And you get what's called the allergic march. In other words, your symptoms are marching along without being treated properly. And many people who have asthma and problems with their nose will know what I mean. If one is bad, the other tends to be bad as well. So it is, particularly if you're asthmatic, important to get treated properly with regards to your nose. It's often forgotten problems with your nose. Asthma is thought of as being very serious and everyone takes it very seriously. But the problems with your nose are, equally serious in some ways. What can go wrong? What can happen with the structure of your nose? As I mentioned earlier, well, you can have a twisted nasal septum, which is a partition between your two nostrils. And this can be deviated particularly to one side or the other. And it may be very obvious. You'll tell me my right side of my nose is blocked or my left side of my nose is blocked, which side it's bent to. But obviously, sometimes it's not so obvious until I look in your nose with my little endoscope. It's important to think, well, you'll think to yourself, I haven't got a bend in my nose on the outside, so I can't have a bend on the inside. But actually, that's not the case. And it's actually more common for people to have a straight nose on the outside and a bent nose on the inside than to have both being bent at the same time. So just because you've got a straight nose on the inside does not mean you haven't got a bent septum. It's something worth thinking about. And the treatment for that is a relatively straightforward operation called a septoplasty, which takes about 40 minutes under a general anesthetic as a day case. And that's very easily remedied once diagnosed. The other thing that can cause a problem is hypertrophy or swelling of those inferior turbinates that I showed you earlier. Now, as you can see, they're really quite large and they do fill up quite a lot of the nasal airway. So if they get particularly swollen with severe rhinitis that I mentioned earlier that doesn't respond to medical treatments, they may need surgically reducing in size. And that's an operation that we term turbinoplasty. So the inferior turbinate is reshaped. The bone that actually is in it, it's a bit like filleting a bit of beef. The bone is filleted out and the actual lining of the turbinate is reshaped to give you far more room inside your nose. Very successful operation for improving the nasal airway.